Hello, Facebook viewers. There are always questions that arise when you talk about infection control in the dental office. Today, we're going to address some of the concerns that a dental practice might have in implementing an infection control program into their practice. Welcome to Schein Chats. My name is Marguerite Walsh. I'm Vice President of Product Merchandising with Schein Dental, and I'm sitting here next to Christina Thomas, the new Executive Director of OSAP, the Organization for Asepsis, Safety, and Prevention. Today, we're streaming live from our Schein location in Woodbury, Long Island. Welcome, Christina. We're so happy to have you here today.
Thank you, Marguerite. I'm really excited to be here as well.
And today kicks off Infection Control Awareness Month, so what better time for you to be sitting here with us to kick off this month. So can you tell us a little bit about Infection Control Awareness Month, how it began, and how OSAP is supporting this initiative?
Absolutely. So Dental Infection Control Awareness Month, we're in our third year of observing this, and it's really a collaborative effort of the profession to highlight and talk about all of the ways dental teams keep the patient safe. It's really to open a dialogue and a positive conversation with patients around safety protocols, and OSAP is really excited to provide resources and tools to help the dental team facilitate these conversations. So it's all about really positive messaging, really all of the things that are standard that dental healthcare providers do when they're delivering care.
So how does a dentist get engaged or the practice get engaged in this awareness month? What can they do?
Well, OSAP has developed a bank of resources that, again, we can all support the dental team in using. So there are talking points, patient scripts that you can use, a sample letter that you could send out to your patients, as well as a customizable brochure that you can use to highlight infection control protocols that the dental team does to keep patients safe, like great hand hygiene or sterile tools, safe water, and patient protective gear like eyewear. So OSAP makes available on the website downloadable materials that then you can use in the dental setting and with your dental teams to, again, highlight those positives around dental safety and infection control.
Yeah, I think this is great because I think it's also important for the patient to know that the office is practicing safe dental care, and what better way to, provide that exposure than during this month.
Absolutely.
Yeah.
I think it's, again, it's about the positive. It's about creating a space for open dialogue where both the patient and the provider feel like they can engage and interact. And again, it leads to a positive and more safe patient experience and helps to demonstrate the practice's promotion of a culture of safety.
Yeah. So we mentioned before the safest dental visit, and I know that's something that is really near and dear to OSAP's heart, I guess you could say. Could you tell us more about what that means and what that means to a practice?
Sure. The safest dental visit is a comprehensive education program where OSAP again provides resources and tools to help the dental team to comply. So the safest dental visit is designed to support education on guidelines and compliance tools as well. Again, it's developed to help support and promote a culture of safety. And also within the Safest Dental Visit program, there are resources to help support the infection control coordinator.
Yeah, there's so many resources out there, I think, that a practice can go to find information on infection control, but how do you know that you're going to the right place? And I think that's one of the things that OSAP does, is take all the resources and provide a comprehensive way for the practice to understand. Is that correct? And
that is definitely the goal. There are lots of places where people can find information, but OSAP serves as a trusted resource. We have great partnerships with organizations like the CDC, where we really try to take the guidance and make it accessible in a format that dental settings and dental teams can easily apply. And again, take recommendations like the infection control coordinator and support dentists and the dental team with ways that they can support and champion this role.
So the infection control coordinator, can you tell us a little bit about that role in the office?
It's a really important role, and in fact, the CDC recommends that every dental setting have an infection prevention and control coordinator. This person is the person on the dental team that's responsible for overseeing the infection control program. They help to, again, stay on top of the guidance and the regulations. And then they also help with training of the team. So, you know, there may be new folks, and every dental setting might has an infection control program or should have one, and the infection control coordinator really is the person that facilitates that the entire team understands and recognizes the infection control strategies that, again, keep patients and providers safe.
And that coordinator, I assume, would be the person that would be engaged with OSAP, you know, having access to all the resources and using all the resources to implement the program into their practice.
Yes, through programs like Dental Infection Control Awareness Month and the Safest Dental Visit, we really do try to highlight the importance of this role, as well as provide resources and materials that the infection control coordinator can utilize throughout the month of September and beyond to support their infection control program. DICAM serves as a great reminder for the infection control coordinator to review or draft an infection control program plan if they don't have one. So we really take this opportunity to highlight very positive things within the profession, and again, try to provide a lot of support through the community of OSAP, through the website for the infection control coordinator to support their needs for overseeing an infection control program.
So if a practice today didn't have an infection control coordinator in place, OSAP would be that resource to actually help them get started and implement a program?
Absolutely.
Yeah.
We have a information on the role. So, you know, kind of what are the
kind of like a job description almost.
Descriptions. There are a lot of resources that if someone is just getting started, they don't have to reinvent the wheel. They're very easy to access on the OSAP website, and people can go there to utilize all of those resources to get started if they need to.
That's great. That's great. So a lot of exciting things for OSAP, right? Yes. I know I'm on the board, and I enjoy, you know, spending time with you and all of the other OSAP board members. So what do you see on the horizon for OSAP? Is there anything coming up in the near future you'd like to share? Or?
Absolutely. Well, again, OSAP is all about highlighting the positives of infection control and dental safety, and we're really excited to be embarking on a collaboration with the Danby and Dale Foundation to advance patient safety. And this initiative will lead into a multi-year collaboration on infection control education and provide an opportunity to assess competency as well as understanding and knowledge of infection control. So we're really happy that not only are we providing these resources, but we're taking it to the next level through this collaboration. And it's really a way for, again, the dental team to embrace dental safety and infection control and demonstrate their competency in this area.
Yeah, this program will be just great because there is such a need to be able to train the dental staff and other members of the dental community, whether it's sales consultants from corporate members or you know.
And that's the great thing about OSAP is that it is a community, and while we focus a lot on the infection control coordinator and all of the resources to support them, we also have resources for educators and consultants and the dental trade, because we all, you know, dental safety intersects what we all do. And so it's great to have a community like OSAP that has trusted information for all of our members and the public through resources like Dental Infection Control Awareness Month.
That's great. Well, I know that Henry Schein has been such a huge supporter of OSAP. I know we were one of the founding members, I think 30 years ago, with OSAP, and it's just such a great organization. I truly enjoy being on the board and working with just a great group of very committed people to infection control and really the safest dental visit. So we really thank you for joining us today here. We're so excited to kick off Infection Control Awareness Month, and I look forward to working closely with OSAP in the future.
Well, thank you for having me.
Yeah, thanks,
Really
Christina.
my pleasure.
Thank you.